Now upper motor and lower motor neuron lesion, what is the difference? So first let's understand what is an upper motor neuron. So any neuron which is coming from the central nervous system and innervating the spinal cord, and from the spinal cord one more neuron is going to the muscle. Suppose this is the muscle, it is going to the muscle. So this one which is influencing the spinal cord neurons, this is called as the upper motor neurons. It can be a cranial nerve also, it is the upper motor neurons. Now coming to this is the lower motor neuron. Whichever is innervating the muscle from the spinal cord, it is lower motor neurons. What is the definition? Neurons which synapse with the anterior horn cells of the spinal cord are our upper motor neurons, whereas lower motor neurons from the anterior horn cell to the skeletal muscle, whichever is reaching the skeletal muscle, they are called as the lower motor neurons. Now, what is the differences between these two? So, the muscle group involved, the tone of both of it, the paralysis, atrophy, fibrillation and fasciculation, reflexes and Babinski sign. All these are different in case of upper and lower motor neuron lesion. So, just remember one point, the upper motor is constantly controlling the lower motor. The upper motor is like a teacher. Whenever the teacher is there in the class, the students will be calm. So, if the teacher is not there, what they are going to do? They are going to jump and do their actions exaggerated. So what is happening? Let's see. So in case of an upper motor neuron lesion, what will happen? It is innervating the various spinal cord muscles, spinal cord neurons. So what will happen? Multiple group of muscles are involved. Multiple group of muscles are involved. So now upper motor is not controlling the lower motor. So what the lower motor will do? It will cause a severe contraction of the muscle because here our upper motor is cut. So there will be a severe hypertonia of the muscle. Then what will happen? It will cause a severe contraction, but paralysis is happening. Here the muscle is having tone, but it is paralyzed. So that kind of paralysis is called as spastic paralysis. It is spastic paralysis. It is not, he is not able to use it, but still severe contraction is happening. So it is spastic paralysis. And already contraction is happening. So will there be an atrophy? There will not be an atrophy usually in case of an upper motor neuron lesion. So there is no atrophy. But if the upper motor neuron lesion is there for a very long time, he is not using his muscle at all. So what can happen? There can happen a disuse atrophy. It is not the atrophy caused due to lesion. It is the atrophy caused due to disuse. Disuse atrophy. So disuse atrophy. Then fasciculations and fibrillations, both of them are absent. I will tell you what it is in the upper lower motor because it is present in there. So they are absent in case of an upper motor neuron lesion. Coming to the deep reflexes. Deep reflexes, what will happen? Upper motor is controlling it. Usually controls the lower motor, but now lower motor is out of control. So whenever anything is struck, it will go to the spinal cord and come back, and influences from the higher centers is not there. So what will happen? It will go to the spinal cord and come back, and the reflexes will be exaggerated. Exaggerated response will be there because the upper motor's negative influence on the lower motor is not happening. So the deep reflexes are exaggerated. Superficial reflexes are lost. Coming to Babinski sign, the Babinski sign is positive in case of an upper motor neuron lesion. All these features are completely opposite on the other side because in a lower motor, now let's talk about lower motor. The upper motor is intact now. Now lower motor is coming like this. The lower motor is cut here. The muscle is here. So what will happen? The muscle is not innervated at all. So the group of muscle involved also will be very, very little because it is going to a specific group of muscles. A single group of muscles are involved. Then what will happen to the tone? The muscle is not getting the supply. Is the muscle getting the supply here? The muscle itself is not getting the supply. So obviously the tone is lost. So it will cause hypotonia. And what will be the paralysis? The muscle supply itself is not there. So how will be the muscle? The muscle will be very flabby in nature. So it is called as flaccid paralysis. Flaccid paralysis. Now muscle tone is not there. It is flaccid paralysis. What do you think? Atrophy will happen or not? If there is no supply, no nutrients to the muscle or impulses to the muscles will go. So muscle is completely, you cannot use it. Obviously there will be a atrophy. There will be severe atrophy. Atrophy is almost always seen. Almost always seen in case of a lower motor neuron lesion. Then coming to fibrillations and fasciculations. Both of them are present in case of a lower motor neuron lesion. So what is this fibrillation and fasciculation? Let's try to understand. So coming to this fibrillation and fasciculation, usually the fibrillation are very minute muscle twitches which cannot be recorded, which cannot be seen with naked eyes. They can be recorded with EMG only. EMG, electromyogram, can only record the fibrillation. Except there is an exception also. There is always an exception to everything. Exception is tongue fibrillation. Tongue fibrillation can be seen with naked eyes. So this fibrillation, why does it happen? So whenever the nerve is cut in a lower motor neuron lesion, there is sudden discharge from the muscle. Here the fibrillation is happening due to the muscle discharge. It is happening due to the muscle discharge itself. Now coming to the sudden discharge, there will be few twitches in the muscle and there will be some neuronal activity in the muscle which is causing this fibrillation. Coming to the second term, that is fasciculation. What is fasciculation? Now the nerve is cut and the muscle is like this, nerve is cut. But sometime what will happen is the muscle will start producing more and more receptors now. Why? Because now it is not receiving any impulses. So it will think more receptors we can produce to get the impulses. It will produce more impulses, and whenever any recovery, during the recovery, any simple stimulus is happening, many neurotransmitters will be released and now receptors are also increased. So this type of behavior is called as denervation hypersensitivity. This type of reaction is called as denervation hypersensitivity. Now more receptors are there and sudden impulses from the denervated nerve is coming. More neurotransmitter is released. So what will happen? This kind of denervation hypersensitivity will cause muscle twitches, which is more than that of the fibrillation. So that's why fasciculations can be seen with naked eye. All fasciculations can be seen. Fibrillation usually recorded by EMG except for the tongue fibrillation. So both are present. Now deep reflexes, will it be present? The nerve supply itself is not there. Whenever we hit it with a knee hammer, it is going to the spinal cord, but the one which is carrying the alpha motor neuron, that cannot come. So obviously it will be absent. So the superficial reflex is also absent. Babinski sign in case of an upper motor neuron is, what is Babinski sign? Like scratching of the lateral aspect of the foot will cause the positive sign. Is normal reflex is Babinski negative. Normally we don't have the Babinski, which is negative. This negative is nothing but the plantar flexion. This is the normal response we expect in case of a normal person also. Same thing will happen in case of the lower motor neuron lesion also. Whereas Babinski sign is positive, means it is the plantar extension. Especially the thumb will go for the great toe will go for extension. The great toe will go for extension, and there is fanning of the other toes. So both these reactions is called as the Babinski sign positive, and it is seen in case of an upper motor neuron lesion.